doing that. How many of the females do you think are actually already careful about things like this, and even when it comes to the eruption of the milk teeth?
Fortunately, it's if we said like from 3 mothers, 1 only careful about her baby.
Yeah.
This is the surprise. We are in shock. We should advise us. We tell them you should do like that. You should bring the baby. Even he didn't complain from anything. You should just make communication, make like chemistry between the baby and the dentist, because even the old people, they had the dentist.
Yeah.
But we recommend to bring him as when he didn't have any complaint, to like us when he become old, because when he happy, okay, he will like to come to the dental clinic. Then he will enjoy. Then he will come again and again and again. Yeah, he will take a lot of appointment. Moms should careful about this, and we always advise the mothers, keep swapping, keep massaging for the baby, and when the erupted is done, keep brushing. There is special dental brush for the kids.
Yeah, it's made out of some silicone kind of
material. Yeah, and a lot of colors.
Yeah, yeah.
And it's definitely a very easy cleaning method too, where I would see my niece's gums being cleaned on a daily basis, where you just put it on your finger, and it's very, very convenient. And even the kids seem to enjoy it, even though sometimes they would want to bite you on your finger. But it is definitely a process that they can very much get used to. Now, Dr. Mahmoud, there are so many of the mothers, of course, because the stereotype is there, and it is well established that the milk teeth are not permanent. So why do we need to take care of them? Because they're going to get out anyways. These are not the teeth that my children are going to live with for the rest of their lives. So I do not really need to take care about how clean they are or how dirty they are, because of which tooth decay takes place, even in those milk teeth, where you see there are cavities being made and the child is constantly crying because of the toothache, and it actually develops in such a young age. It is very difficult for the child to take care of, and then you give your child all sorts of medications. So talk to us about tooth decay in milk teeth.
Tooth decay, it's start to as when it's coming, and we didn't like to see it, but when we see it, first we can make a filling before it's going to the nerve, to the root of the milky teeth. It will be simple filling with maybe topical anesthesia or nitrous oxide. This is not injection, because you know the kids, they don't like the needles. This is the big scaring for the kids. So the filling will be help him to can eat on the caries tooth. When we remove the caries and we clean the tooth and we put the filling, then it's done. But sometimes the caries going deep, and you see the baby kids is infected, like swelling or something. You don't like to see your kids like this. You will be, and why I didn't bring him before? Yeah, you see? That's the mom, they said, after after they bring it to the dental clinic, antibiotic, it will be fine and help the kids. It's special antibiotic for the kids, special dosage. And we clean it and we remove the nerve. We call this pulpotomy, sometimes pulpectomy. Then we put the fillings. In worst scenario, we can remove the tooth, the baby tooth, early, and that's what we don't recommend it, but this is the worst scenario. And we put like a space maintainer, because we care about the inclination of the tooth. The baby tooth will not make space for erupted the permanent tooth. I said first, the milky tooth is like guide for the permanent tooth. If you didn't care for your milky teeth, it will disturb the erupted of the permanent tooth.
Right.
Yeah.
And Dr. Mahmoud, I mean, you just mentioned about tooth decay and dental caries as well. Now, if any of these conditions happen in the milk teeth, then how it is that it can actually harm the kids eventually when the milk teeth, the children are going to lose their milk teeth. So how does it continue with the new teeth as well? Does it actually happen?
This, like, if there is genetic defect in the kids, and from the calcium, from the food, nutrition, like habits. He like to sleep. Some kids like to sleep when he keep the bottle in his mouth, and this is, we didn't like, and we always advise the moms about it. Never leave the kids sleep with the bottles of the milk. Maximum keep water in the bottle, but don't keep milk inside his mouth, and when he sleep, it will big effect on the tooth. Decay will happen faster than the other kids. And when it's continuous and continuous decay, it's happening, that's meaning he should care about the nutrition, the food, like this.
And how frequent it is that you hear of mothers leaving the bottles in the mouth of the children?
It's popular here.
Yeah.
It's popular. It's so cool. It's like, you know, it's something so famous.
Yeah.
But, doctor, we understand that tooth decay takes place in any kind of a teeth, be it the milk teeth or the permanent teeth that we are going to be having in our adult lives. But perhaps the one thing that is a little more painful is you are going to be having your child go through so much of a trauma just because you did not put in the cleaning. So please, ladies, this is all out for you. Do not really keep your mates to try and think they're going to be taking care of the oral hygiene of your children, because they do not really care if your children are going to be ending up with dental caries or even having their tooth to be pulled out. So please take it as an emergency service for your own selves. Talk to us about how many children actually come to you with severe dental caries in their teeth for it to be actually removed. Do you think it is a very common practice for children to come with a gum problem, or very little kids to come with a tooth decay?
Yeah, I'm so sorry, but that's happening a lot now in this time. Recently, we see like about every day you see 5 to 6 kids like this, and not all milk teeth have decay, but at least 5 or 3 milk teeth have like this. And there is one more thing to can prevent the caries before it starts. We make like fluoride application. It's gel, nice smell, and pink color. They like it. We just keep it. It's reduced the bacteria that's causing the caries to start and establishing in the mouth, in the oral hygiene.
So getting fluoride application is really good for the teeth of the
Yeah, it's
children.
helped them to can prevent the decay it's happening.
Now, Dr. Mahmoud, when talking about dental caries or tooth decay, now when we go to the supermarket to buy toothbrushes for children or for adults, or even toothpaste, you get to see such huge variety, and then you see all these advertisements and commercials which are promoting their own toothpaste brands, and they say that this particular toothpaste, if you're going to use it for children, would prevent tooth decay, would prevent dental caries, would prevent cavities, and so and so and so. Does that actually happen? Can a toothpaste really prevent cavities and keep all those kind of germs away from your teeth?
Exactly, but we didn't care about the company, about the commercial. Yeah, we care about the which type it's better for you. Yeah, some brushing soft, some brushing hard, some brushing medium. According to the gum of the baby, I can choose which one better for him. Almost the kids like smooth brushing. Yeah, because it doesn't hurt him when he make brushing. Understand, but the hard one and the medium, maybe it's hurt the kids. So, and they like the what's coming with flavor, you know, strawberry or something will be nice. They will like it. It's help him, yeah. At least if he use it for 3 times daily, morning, afternoon, night, it really will. It will make different. It will make different, yeah.
Right. Doctor, these days we are seeing there are such cute ads where these toothpaste companies are actually showing all of these monsters in the children's mouth, and the children get to understand that, well, if I do not brush my teeth, then monsters are going to be coming in my mouth. So they are really advertising in a great way, because nowadays the children can actually learn, if we do not brush our teeth, then this bad things are going to happen to our teeth, and it will be very hurtful, it will be very painful, because then the monsters are going to win and we are going to lose. So it is a very interesting way of actually educating the children as well. well. So talk to us about how is it that you would like to perhaps teach a child as to how important it is for them to clean their teeth by themselves, because lots of the times the parents just get sick of running around the whole house with a toothbrush with toothpaste on it for the child to actually brush it. How is it that you think perhaps we can make a brushing experience a little nicer, a little more fun for the kids?
If you give him like incentive, if you brush your teeth, you will take gift. If you brush your teeth, I will take you and I will give you something you like it, you know.
But don't offer candy.
Yeah, don't offer candy, but yeah, for shopping or mall or something. And if you want to see your movie, during the movie, hold your brushing and brush your teeth. Nice. It will take long time because not problem for brushing. I brush, but for 20 seconds is not enough. Brush well, please. You understand? At least for 3 minutes. When you're brushing, yeah, for brushing well, at least for 3 minutes. Up, top, down, right and left, inside
Yeah, we
and
have a lot of teeth in our mouths. We really should.
For the kids, about exactly 20 teeth.
Yeah.
20. For the old permanent, it's 32,
Yeah.
including the wisdom.
Yeah.
The wisdom is the last tooth. And we have this week, by the way, is like National Week about the healthcare, dental healthcare. It's this week. And we make like event for this in Gharnata Mall on Tuesday and Wednesday. I invite all kids to come there. It will see a lot of activities there. We teach them how to brush, how to use the dental brush, how they can gargle sometimes with mouthwash. It really helps him.
So, well, it is an open invitation. We will have it on our Facebook page for all those of you parents who have actually woken up a little bit on the aspects of how important it is for you to be cleaning. If you want perfect teeth like Dr. Mahmoud, then take care of them as soon as your first milk tooth appears. Dr. Mahmoud, since we are going to be completely running out of time, give us one message for all of the women who are watching us at home, and also the kids, for them to maybe get a little scared and actually go on and brush their teeth right.
If you want to have nice smile now and in the future, you should brush your teeth. Start when the 6 months, when the first one is erupted, even it's small, even it's two, only brush it and take care about it, because it will help you later on in your future.
Indeed.
Exactly.
And with this, we would really like to thank you, Dr. Mahmoud Al-Aham, for joining us.
It's my pleasure.
It definitely was an interesting session. So the conclusion of the very topic of discussion is that milk teeth are equally important, if not perhaps a little more important than your permanent teeth, because they are, as Dr. Mahmoud said, going to be lying down the foundation of how your permanent teeth are going to be. So please make sure not to have those ugly black teeth in your children's mouth, because it's not a pretty sight, and it's also going to be a painful experience for those little toddlers. If you really want to know more, there's a leading mall having a dental healthcare week starting Tuesday till Wednesday. We are going to be having all of the details on our Facebook page. For the moment, we're going to be moving on, thanking Dr. Mahmoud Al-Aham. He's a dentistry specialist. We are going to be ending our discussion here, moving on towards a report. To stay tuned.